Welcome back to Newsday. The need to reform and redefine surgical practice in Nigeria has again been brought to the fore at a conference held in Lagos. The meeting brought together senior medical professionals, surgeons and students to examine concerns that current surgical training in Nigeria places too much emphasis on technical competence while neglecting key human-centered aspects of care. Speakers at the event highlighted the importance of communication, empathy, leadership, and patient engagement. They advocated for a more balanced model of surgical education, one that equips future surgeons to operate not just with skill, but with compassion and responsibility.
The whole surgeon, you're not just talking about being in the operating room and being able to perform good surgery. You're actually talking about the total picture. So you're talking about the personality of the surgeon. You need to build a brand with a high focus on what the patient expects from you as the outcome of the procedure. A lot of the people in this room, they're young, they're dynamic, and I don't have any doubt that those are the people that are going to build the future, a bright future for Nigeria.
Earlier in medical school, there's a lot more focus on other things outside of just the theory of medicine. I think bedside manners, understanding the responsibility that we have as surgeons, preparation, teaching those students to have significant attention to details. All of these things are going to help to create what I believe will be a wholesome surgeon. And they need to understand that the patient is not just a shoulder, they're not just a knee or a hip or the part of the body that you're operating on. And institutions can help students understand this, that the patient is an entire being.
As medical students, we get to see both sides, the patient side as well as the consultant side, the doctor's perspective and the patient's perspective. And what we are trying to do is build whole surgeons who are versed in both physical spaces where they can actually do what they are supposed to do, as well as in places outside of the OR where they are empowered, they have skills that make them better and function greatly in places outside of the OR. And these skills that they gain in the OR are then transferable.